Well, welcome, Dr. Chaand Nagpaul. Thank you very much for joining me this morning. And I'm delighted that you're here for this interview. And I'd just like to introduce you a bit to our readers and our viewers, if I may. You're here to speak in your role as trustee of the charity Doctors in Distress that we, the MDU, have just started a partnership with, which we're delighted about. And I was thinking perhaps this is quite a natural role for you, this trusteeship, because the dedication you've shown throughout your life as a practicing GP also to supporting and representing doctors is remarkable. You were chair of the BMA GP committee, chair of the BMA council leading the profession right through the pandemic, and you've chaired also the BMA wellbeing support network and the BMA Forum for Racial and Ethnic Equality. You're on the board of the NHS Race and Health Observatory. You've been awarded Fellowship of the Royal College of GPs, Honorary Fellowship of the Faculty of Public Health, and a CBE for services to primary care. I really need to stop for breath after all that. It's incredible. And I'm utterly delighted that you're kind enough to give us your time today to talk about doctors in distress. So thank you. Your charity, of course, your vision, I've been reading about, is to prevent suicide in healthcare workers. And that's generally healthcare workers. But for the purposes of this conversation today, I think we'll focus on GPs. And what I'd like to ask you about to start with, you're a practicing GP, is just to give us your view and your perspective on the enormous pressure that GPs are under at the moment, at a time when we know from our perspective, our file numbers are on track to make this our busiest year ever.
Thank you so much, Catherine, for inviting me to be able to speak to you about the pressures facing general practice and what maybe can be done about that. I should also mention that Doctors in Distress was, of course, founded after the tragedy of a death of a consultant cardiologist, which led his brother to form this charity. But the charity, of course, is very much involved in trying to improve mental health and to prevent doctors getting to that point. So it's not just about preventing suicide, but it's also about promoting and protecting the well-being of all healthcare professionals. With regards to general practice, we're suffering at the moment basically a mismatch between escalating, or rather rocketing, demand and a reduction in the numbers of GPs and capacity of GPs. Unfortunately, since 2015, we have about 2,000 fewer whole-time GP equivalents working in our health service, and yet we've seen consultation rates increased dramatically, in about 19% since before the pandemic. And on top of that, GPs are now providing much greater levels of care. It's not just consultations, but what they provide in terms of the complexity of care for patients. We're managing patients who would otherwise have been seen in hospital clinics ongoing. We're following them up, and we're seeing people discharged early, and we're managing them in the community. So the workload has expanded exponentially. Now, it's really unfortunate that surveys have shown that 8 in 10 GPs report that they feel stressed, anxious, or depressed. Now, that's a striking statistic showing the degree of distress amongst GPs. 48% of GP practices have reported losing GPs from work, from their practice, because of stress or burnout. And tragically, one survey showed that 1 in 4 GPs had heard of a colleague who had taken their own lives. So GPs are under huge strain and pressures. And I think that the workload, demand, and lack of capacity translates into issues such as the fact that we see patients at ridiculously short consultation times, 10 minutes. And if you're lucky, maybe 12 minutes in some practices, but that's woefully inadequate for the complexity of care that we're trying to provide. And the Commonwealth Fund did a comparison of OECD nations, and the UK GPs had the shortest consultation times compared to GPs, for example, in France and Germany, where they're spending 15 to 20 minutes. About 7 in 10 GPs feel that the way in which they're asked to provide care, these short consultation times, the high numbers of patients, are impairing their ability to provide safe care. Yeah. And of course, that means that GPs go into work worried about making a mistake, and that adds to stress and anxiety.
Yeah.
The long hours mean that they don't have time to rest. So all of this, accumulates. And what we're seeing is, and I've never seen this before, young GPs in their 50s retiring early. It's almost become the norm that I meet GPs who are reducing sessions because they cannot cope with the workload.
Yeah.
And what that means is that you then add further pressure on all of us when we work, because we don't have the GPs, because GPs are obviously trying to protect themselves by either reducing work or retiring early. And at worst, many are taking time off sick. And I'll
Yeah.
come back to that. I probably don't think enough, because doctors will go into work even when they don't feel well. But this is all a cumulative phenomenon that is resulting in considerable distress amongst GPs. I think the other thing to mention is that the way GPs provide care is very personal and individual to patients, and they feel individually accountable and responsible. It's just the GP and the patient in the consulting room. And therefore you get to know patients. There's the continuity of care. You feel the patient's distress. You see the impact of their health on their lives, which isn't quite the same when you see a patient, for example, for an episode of care for a particular condition in an outpatient clinic. And it's not the same, for example, when patients are cared for in a ward in hospital, where there's a sense of corporate teamwork. But with general practice, it's you and the patient. And that, I think, does add additional accountability, vulnerability, and pressure to make sure you do your job well.
Yes, enormous pressure. And when we were speaking before, you mentioned that as a GP partner, there perhaps additional layers of pressure because of all the other things apart from clinical care that are on your plate as a partner. Would you like to say a little bit about that too, about those pressures?
Yes, I think that often it's overlooked that GP partners are, of course, responsible and accountable for running their practices. And that is a huge responsibility. It is about regulation with CQC and all that goes with it, the preparation, being sure that you're compliant with a never-ending list of regulations and contractual obligations. It means running your practice in terms of the way it's managed, about HR, making sure you've got the right skill mix of staff, making sure they are working as they should. You're responsible for their acts and omissions because you are responsible for the practice. If there are HR issues such as a grievance, etc., as partners, you are ultimately responsible. If, for example, hopefully that doesn't happen often, but if there was an employment tribunal, you as a partner will be responsible, not some chief executive or HR department. And of course, just making sure that you're keeping abreast of changes. In England, we have primary care networks, so each GP has to have a partner or lead GP that is responsible for making sure that the practice engages within that agenda. Just in terms of making sure that we get enough resources, there's QOF, there's enhanced services, and a range of other local commission services that practices provide. Again, as a partner, you're responsible to make sure the practice achieves financial balance and solvency so that you can pay your staff and provide care. And so you need a huge amount of additional skills and responsibilities as a partner. Now, what we're finding is that more GPs are shunning partnership, and we're seeing a reduction in numbers of partners because they find this additional responsibility and workload on top of being a GP seeing patients too much. And I am worried, because what that means is that existing partners then feel under greater pressure as they lose their colleagues. And that's also resulting in some practices literally handing the contract back because they don't have the partners to run their practices. So I'm worried about that.
Yes, yes. Thank you. I can, yes. And people under such incredible pressure doing these amazing jobs, but under such pressure do become mentally ill. And I wonder if you'd like to give us your thoughts about the stigma that exists around mental health in the healthcare sector.
Yes, I am concerned that there is considerable stigma amongst the medical profession and a lack of openness about mental distress. I think part of this is about the fact that doctors see themselves as healing and caring and treating others, so they don't want to be showing their own vulnerability to patients to give patients confidence that they're going to be looked after. But I think it's really important that we almost reframe that into making it much more open and understood that doctors are human beings just the same as their patients. And they're prone to the same stresses and strains, in fact, in many cases more so than the average member of the population. And it's important for that, I think, to come out into the open. And instead of seeing this as an issue of shame, it should be an issue of normality about the fact that you are human. And I also think that by being human and experiencing the same distress and mental and issues and lack of well-being as the people we care for, there's greater chance for empathy and a greater chance, I hope, that patients themselves will respect that they can be understood by the doctor they're seeing. So I think that's really important. I think the other thing for GPs in particular is that they develop very close relationships with their patients. They see patients on a continuous basis. I've known patients for 34 years since I joined my practice.
Wow.
And what you find is that GPs don't want to let their patients down. And they feel they even change their holiday plans. They even, feel guilty about taking time off because they're in the middle of caring for a patient. So it's very individual, that relationship, which isn't quite the same for many other sectors of care for patients. For example, often if you're in hospital. So I think that also adds to GPs not wanting to reveal their vulnerability.
Yes, those are all really important points, and that stigma is definitely, unfortunately, still there. And you've talked a little bit already about destigmatizing by being more open. Is there anything else that you think can or should be done to help destigmatize mental ill health and distress amongst medical professionals?
I think there needs to be openness right from medical school training and upwards amongst the profession, amongst policymakers, ICBs, NHS England, and the equivalent authorities in the devolved nations and government, that being a doctor is a highly stressful job, and that we should be aware that with it, you can have, and you do have, doctors naturally having mental health stress, pressure and distress, and we need to be open about that. And I think that what we need to do is to be open about it at a much earlier stage, because in fact, for many doctors, they reach a point of severe distress because they haven't talked to anyone. So we need to create a climate, a working environment where the first thing is prevent. Have an environment where you create space for colleagues to just say hello to each other, to talk about anything that they may feel upset about or stressed about, because often by just doing that, you prevent issues progressing and you allow yourself to actually cope because you've got that sense of camaraderie and peer support. And I think we need to make that the norm. But what we're finding is that GPs in particular are working flat out. They barely get a chance to have coffee or lunch, leave aside being able to spend time with their colleagues. So I think we need to build that in. We need to also build in a much more open culture where a colleague can go to another and just say, I've had a really bad day, or I'm worried about this patient, or I'm worried about this. But also don't forget that GPs are also human and they will have stresses outside the practice, personal stresses. I met a GP recently who was having huge stress from a breakdown in his marriage. And when I asked him, have you told your partners? He had told no one. And yet he was working for about a year, experiencing huge personal distress, and he had told no one, and he was just putting on a brave face. We need to change that. We need to be making sure that we encourage colleagues to just be human and support each other, because we will need that support, because we're all human sooner or later. So, that's, I think, what we must do at an early stage. But also, we need to make sure that GPs and doctors more widely know that they can go somewhere for help. So we do have avenues. We have, for example, our own charity, Doctors in Distress. It provides free, there's no charge, workshops where GPs can go for defined and facilitate workshops for defined numbers of sessions in a safe place where they can talk about the distress they face and the issues they face. And doctors have felt that experience to be transformative for them and has made a huge difference. You can, of course, go to your GP, but in fact, GPs do, this is an issue. GPs find it hard to take time off work and sometimes don't feel comfortable speaking to their own GP. And I think at a policy level, we don't have in general practice the same occupational health services that our hospital colleagues, take for granted. And I think that is something that needs to be addressed. But we do have the practitioner health program for any GP who feels they need medical care, and that includes mental health care with practitioner health.
Thank you very much. Yeah, practitioner health is a service that we in our role here are familiar with and have incredibly high regard for, and also the BMA wellbeing service, which you've obviously been involved with too. I often find myself signposting people there. And thank you also for referencing the excellent work that you provide as a charity. I wonder if we should say a little bit more about the programs that are on offer there. You've mentioned support programs for a defined period of time. I should just say that I'm aware through our partnership there are going to be some specific peer support sessions for foundation doctors and webinars for medical students, as I understand it. But is there anything you want to add about programs for doctors out of foundation training or any doctors more generally?
So we provide a range of services, and it's important that if any doctor or medical student wants to know what we provide, just give us a call or look on the website. The other service that I think is really important that we do provide is support for international medical graduates. Of course, any doctor coming here from abroad is working in a very different culture and climate, and even more so in general practice. And it's really, I think, important that doctors from other countries, often separated from their family or do not know anyone in this country, are not isolated. So we also provide specific support programs for international medical graduates.
Thank you. That's important to know about too. So people can give you a call or look on the website, and there's lots of information on there. Thank you. Just to wrap up, finally, you mentioned the arts and the power of creativity in the arts to help people's well-being. And you mentioned in your bio that I read that you're a music lover. I am very much too. I find it very helpful for my own well-being. Of course, music tastes vary very widely, very personal. But shall we round off? Do you want to give us a recommendation of an artist or track that we could check out that we might enjoy?
Well, I mean, I have such an eclectic taste, so it's very hard to pin down. But I love jazz and I love live jazz. And I have to say that it's one of the greatest antidotes to stress, just walking into a jazz club. And I've been a member of Ronnie Scott's since being a medical student. And I think music transcends, everything. So my favorite artist is a jazz trumpeter, Miles Davis. The album that I would say is my favorite is called Kind of Blue. But I also love singer-songwriters like Bob Dylan, remembering, of course, that lyrics also express, the reality of life, stresses, etc. And by, I think, engaging in music, it can be de-stressing, for me at least. But I think, all doctors should tap into whatever they find gives them pleasure and make sure they find time for it, because you do need to look after yourself.
Yeah, and that's a very good note on which to finish, isn't it? A blue jazzy note of looking after yourself. And I'd just like to round off by saying again a huge thank you for your time today. That's been a really interesting and important interview with lots of information for our viewers and listeners. So thank you, Dr. Nagpaul.
Thank you, Catherine.